All right, here we go. Good morning. This is Coffee and Chat with Rev Bruce. Getting it started today. Definitely want to let you know that it is a bright, sunny morning here in San Diego County, and so I'm ready to roll. Got my coffee, ready to chat, and just definitely want to take a deeper look into some health issues today. Got some exciting guests coming in the rest of this month that'll be talking about community, talking about service, talking about making changes. And so I really wanted to get into this today about some health issues, taking a deeper look at it. We hear about it a lot of times and we see it going down where people are talking about things that are happening. And this is not just for those that are, you know, looking at it from a perspective of, here it is, 2020, and we're one of the healthiest, um, strongest nations in the world. We're suffering right now here in California. We're about to go into a deep, probably a deep um, quarantine, stay at home order coming up, and like I say, our program, part of our program is Awaken America, which is the aspect of advocacy, awareness, and action. And with those three areas, we try to focus on getting all of our people, I mean, people on the ground level, people in office, people who are trying to get some things done, getting all of our people aligned and moving towards that awakening where people will actually take charge of what's going on in their community. And so take that into account and consider that as we get rolling today and get some things moving. Definitely spend some time, if you can, spend some time with me today as we look at these health disparities and what they mean. If you can, like I said, there is there's a like button, there's a subscribe button. Definitely hit those. Get in tune during this week by week. And I gotta say, 26 weeks. This has been 6 months. This has been a joy. This has been something that has really gotten me going and keeping me going. And so, um, 26 episodes, that equals 6 months. And we've been in it, and we're going to keep going. And this is something that I'm really feeling right now. And I'm happy about it. I'm glad for it. And we'll continue to keep going with it. And so, next thing you know, as we talk more about this deeper look at health issues, it comes down to this, and this is the big picture. You know, health disparities, and health disparities. Just as I put it here in layman's terms, it just means there's some health issues that affect certain racial and ethnic groups at a disproportionate rate that impact daily living and longevity. That they cause some groups of people to die earlier than other people. They cause some groups of people to suffer more with that. And it's not just racial and ethnic groups, it's also minority groups. Some things that affect women of color more so than other women. Some things that affect Jewish women more than other women, or Latino women, or Polynesian women, Black women. You know, those are just subgroups of the larger groups. And then there's some things that affect poor people, people that live in rural communities, people that live in urban industrial communities that they're affected by that. And so, since they're affected by that, their health, therefore, is affected by it. And so, when we look at it, how is this, how is this that these things continue to plague, different groups more so than others? These are health inequalities, these are health disparities, and they continue. And as we go forward, we have to look at how they're dealt with. And so, um, put it on another scale. We talk about health, healthcare, and this thing called healthcare, and this healthcare debate, and what does that look like, and what is that all about? And this healthcare debate has broken down into all sorts of segments of society, particularly in the political realm, with legislators siding with or siding against universal health care and how that would come about. And so in the first half of 2020, 43.4% of U.S. adults ages 19 to 64 were inadequately insured. That is statistically unchanged from the last time we fielded the study in 2018, according to Commonwealth Fund .org. And what needs to be developed is a system that supports health services to all citizens without consideration of pre-existing conditions or socioeconomic status, such as employment. Look at models in Canada and England, other countries that have, what would be exemplary universal health care. And so those models are something that we could look at and possibly live with. But right now, we're still debating on whether it's feasible, to actually insure our own people, to provide health services to people, in the country who are citizens. That means young, old, and those with pre-existing conditions and otherwise. And so with all that, here we go. We're talking about people living without health care, and what does that look like? What is happening? And so, that's the big question right now. Is this something that's not feasible for us to do as a nation? Is it something that we don't have enough funds? We don't have enough, dollars in the reserve. We don't have enough, money in the bank for that. And you know what? That just seems to be a mute argument when we look at other countries and what they're able to do. And so, boom, here we go. This is part of where I'm struggling with it. It's, listen, stop calling it healthcare. Just stop calling it healthcare. No matter if you call it Obamacare or universal healthcare, if care was included across the board, it would not be up for debate. And so this whole idea of healthcare is not what most of us get when we go into the emergency room, even when we visit our physician. I recently changed physicians within the last year because I didn't feel like I was receiving the type of care that I should get, especially if I'm paying, whether I'm paying it out of my employee package or if you pay through a HSA or any of that, the type of care you receive, there's an expectation with that. And so if I'm not receiving the care, what it really is just health services. And so just drop care altogether out of it, and people will know not to expect a certain degree of bedside manner from those physicians and health professionals that they deal with. And I want to say there's a lot of folks out here that are, rocking it as health professionals, as caregivers, as supporters within the health industry. You've got the dancing nurse that was, getting all sorts of, play and airtime lately. And so those people have a heart for service. And I have to pay homage to a group that actually helped me when my mother was, suffering with cancer and going through hospice, Apriva. Apriva was above and beyond my expectation as a family member, and one dealing with supporting and trying to get the proper amount of care for my mother and also, her facility. And so when you find people that have a heart for it, that's when it's healthcare. And when you have people that are just doing it because we need to get other folks into this emergency room, we need to get other folks into this bed, that's health services. And so right now it's an overload of health services, not health care. And so I say that, and I also, like I said, pay homage to those that are in the industry, in the health industry, that are doing it and doing it with the heart of service, that really want to have, people turned around and supported. And so, God bless them. And so when we look at this and we say that healthcare is an issue and that there are health disparities and that there are health issues, there are health inequalities. And I just want to say, let's be real. Let's be real. I'll just look at a certain segment of groups and then give you some programs that exist in order to address these health issues. But we're just going to look at Black males. We're just going to look at, Black non-Hispanic males and what's killing them, and what's killing Black males, in our society, boom, here it is right here. This is according to the CDC. It says number 1 is heart disease. Number 2 is cancer. 3 is unintentional injuries. That can be accidents, whether vehicle, machinery, factory, workplace hazards, things of that nature, right? Number 4 is homicide. And number 5 is strokes, and then diabetes. I won't go through the rest, but take this into consideration. When it says homicide is not limited to gun violence. And so that's another part where if you look at some of the commentary that's on the news, whether it be CNN or other channels, where individuals are giving their opinion that, Black men are dying at the hands of bloodshed, that's 5%. And when we look at that, that's not the main killer of Black men. Okay. And is it an issue? Heck yeah, it's an issue, because crime and crime statistics are labels, and how they're labeled affects communities and how communities are seen by those seeking to move in the community, seeking to open business in the community. And so there's a lot at play with these statistics, even when you flip it around and say crime statistics as opposed to health and safety statistics. And so the top issues are heart disease, cancer, accidents, homicides, and stroke, and then diabetes, right? And so let's take that into consideration. And then let's drop in on this, right? Let's drop in on how does that, affect the day-to-day life of a Black man in the United States? How does that affect the day-to-day life of a Black man in the United States? What can he do to prevent one of these, or deter or curtail one of these from happening? If we're not just talking about those exposed to lead paint, you know what I mean? We're not just talking about those that are dealing with things that have exposed them to asbestos and all that. This is not just that. And so to take it further, we would look at other stats that would give us information. And so when you look at statistics, you can't just look at the surface and say, oh, well, I guess Black men aren't, getting shot to death, really? Because here we go. This is another element of it. When you break it down by age group, look at this and see where homicide ranks first for those that are 1 year old to 44 years old, right? For those that are, young, our youth, our children, those Black males have a 35% chance of dying by homicide, right? And then if you're 20 to 44, that breaks down to a 28.9% chance of homicide. It's not until you get into your mid 40s where the stats actually alter, right? And homicide becomes less of an issue, And so when we look at it across all ages in the far column, that breaks down across all ages, homicide is 5%. But when you look at youth and young adults and, adults that are moving towards maturity, you have homicide and suicide, right? Both in the top 5 of what's killing Black males by age group. And so when we look at homicide and suicide, how we address those with prevention, in communities and education and information and awareness. And that's all not just by, when we talk about gun legislation, that's all not just people who shouldn't be buying guns. That's also people buying guns that are called ghost guns, guns that have no serial numbers, guns that have been passed around and moved around and in the black market, And so when we talk about gang activity, we talk about drive-bys, we talk about retaliation and killings like that are quote unquote senseless, that people have a lot of media hype about. That right there primarily is not someone just going into a gun shop and buying a handgun and having it registered. That's usually someone that shouldn't have a gun, who has obtained a gun from some form of black market, underground market piece. And that's a whole nother discussion about gun violence in itself. But I want you to see the stats and understand that this right here, this is about, when we look at the stats, we got to dig deeper to see what it is. And we can't simply rely upon the news media to present it, even if, I'm going to say it like this, even if the person presenting the news looks like you, as far as, they may have the same identity as you, as far as like, African American, or they may have a woman up there presenting statistics on women. If the information is bad, the information is bad. Or if the information is just merely surface information, that's what it is. You got to dig deeper. You got to go into it and look at, where are these stats coming from? When do these stats apply? One of the things I did discover in my research is that most statistics that are available to us are anywhere from 3 to 7 years old. And so a lot of the data is still dealing with 2017, 2018, right? And we haven't even gotten to the stuff that's happening currently with 2020. And so be mindful of that. This is something that occurs frequently, that the information has been put out there, and it's been put out there in such a way to where you may not know the source of the information. You want to find out, who's the source of the survey or the poll or the statistics, and get your information. At best, I try to go with the CDC, Office of Minority Health, National Institute of Health. Those groups, Pew Institute, they tend to have most valid information as far as those type of statistics, especially when you're talking about health. All right. And so as we look at it, that's what's killing us. And so here's some information about how the government addresses health disparities, how the government addresses health disparity. And so one of these programs is called REACH. One of these programs is called REACH. That's the acronym, right? And it's an acronym for what is called Racial and Ethnic Approaches to Community Health. Racial and Ethnic Approaches to Community Health. And this is something, through the CDC, right, that looks at how to reduce racial and ethnic health disparities. Okay, there's a further explanation of this that gets deeper, right? And I like how it explains it, on their website, and it simply says this. It simply says that through REACH, recipients plan and carry out local, culturally appropriate programs to address a wide range of health issues among persons who are Black or African American, Hispanic or Latino, Asian, American Indian, and natives of Hawaii, other Pacific Islands, and Alaska. And so that's programming that's designed, right? That's designed to address, these health issues in a manner that fits where these people live, where they come from, what their cultural background is. And so you're talking about a wide expanse of people that have varying culture in varying situations. When they talk about you can't reach people in Puerto Rico the same way that you're reaching people in border towns in Texas. You can't reach people in Alaska the same way you're reaching people in Watts. There are some differences. There are some cultural issues that are different, and there are some community issues that are different. And so think about that, and think about how these different programs are actually helping out in addressing issues of health disparity in a culturally relevant manner. Now, listen, I don't want it to be like a Barbie doll model and it's just, where, hey, it's the same dimensions. All we did was just add some Black folks. It's the same dimension. All we did was add some brown or Asian people. You know what I mean? It needs to be, like it says, culturally appropriate, right? And so dealing with everything from nutrition all the way to exercise, as well as are there safe areas where people can get physical activity. And so REACH is a program that is set up, right? And it is set up in order to deal with health disparities. Now, this other program is Healthy People 2030. There used to be a program called Healthy People 2020, but guess what? We are in 2020, and the goals of Healthy People 2020 have shifted and moved to Healthy People 2030 because every decade there is a program in place, right, that deals with, this healthier future for all. When they say all, that means all types of people and all types of conditions. And so they have their own set of national data-driven objectives that are set to improve both health and well-being over the next decade. And so keep an eye out for that. Look at their website and their information. I'm definitely a proponent of, check their website out, see what they're talking about, and how that goes. And I definitely say check out what they're talking about and what that means. And let me make sure I give you the website for REACH, because REACH is also it's a good program in what they are trying to offer. And as citizens, you got to get in there and tell the government sometimes, hey, you got this program, it's in place, but I don't see it helping people in this area. I don't see it helping people in this other area. And so listen, part of Awaken America is we need to call it what it is, know what it is, and know what we're talking about. And when we talk about that they're not supplying what's supposed to be supplied, we need to know what the expectation is. And so that's important. And so this is the link for REACH, and I already shared with you the link for Healthy People 3030. All right. And so we look at this and we see that there are these health disparities, and all this and all that's being said and done, I just want to say this, right? Join me in this personal challenge. And this personal challenge that I'm talking about is simply a 10-day detox. When I look at heart disease, when I look at stroke, when I look at cancer, there's a lot of things that we can do to prevent that. And so this is a 10-day detox challenge that will allow us to kind of get set up right before Christmas. You can enjoy whatever you enjoy on Christmas, and then get back into it again, and get set up for the new year, and purging yourself and make a lifestyle change. Listen, I know a lot of what we eat is is tasty. It's we're eating for taste. We're eating for fellowship. We're enjoying the company of each other. We just had Thanksgiving where people were bummed out because of these restrictions. But think about it. Elijah Muhammad wrote a book a long time ago, Eat to Live. We're designed to eat food to have energy, not quote unquote enjoyment, right? And so the most important factor of food is nutritional value and what we get out of it. And so if we're eating a lot of processed food, a lot of packaged food, a lot of food through the drive-through or takeout, we're lessening, right? We're weakening the nutritional value that we actually take in. I'm moved to offer this personal challenge because this is something that I've struggled with. Hey, listen, I've watched Game Changers. I've watched A Place at the Table. I've watched Sicko and all these things. Supersize Me, and it comes down to we can kill ourselves with the dinner plate. We can kill ourselves with what we eat, and we have to be more conscious of that. We have to be more responsible with that. And this 10-day challenge comes from a biblical point. Daniel, a prophet in the Bible, in Daniel chapter 1, when they are captives, Daniel has decided and determined that he's not going to defile himself with the king's delicacies. And so he goes to those who are over them and seeks to have a diet of pulse, which is a form of vegetables, and water. And he says, test us for 10 days on a diet of vegetables and water in Daniel 1 and 12. And, let's try it out, and I say this, join me in this challenge, right? Join me in this challenge, 10 days. It's a detox challenge, right? And I say detox because, drop the packaged food for a minute. Drop the processed food for a minute. Drop, I love getting pizza every Friday. When I call Round Table, they know my name just by the phone number. You know what I mean? But let's get this straight. Let's get this and do this differently. Let's make this happen in another manner. And so, go to my Facebook, my Facebook group, Life Path Multimedia. Just request membership. I'll let you in. Boom. We'll start, loading up on the 9th with information and really gathering as a support group, and get your shopping list together. We'll offer some tips, some recipes, some links that can get you through these 10 days. And then if you can do 10 days, you can probably do 15 days. If you can do 15 days, you can definitely do 20 days. And if you can do 20 days, I know you can do 30 days. And so let's just do it and support one another. Let's do this and be there for one another. And so I just want to make sure that people have an opportunity, right, to better themselves. And I'm not going to be any better challenging you if I don't challenge myself. And I've got stuff I need to work on. We all do. And so I'm here trying to get this thing done. And this challenge is not just for you. It's for us. It's for us together. Like I said, look at the stuff that's killing us. That's just one subgroup, right? And when I looked at obesity, women of color are higher in obesity than any other subgroup. And so think about it, not only as a woman, but also a woman of, racial and ethnic, descent. You have these other health disparities, these other health issues. And let's be honest, in most of our cultural aspects, women tend to be the caregivers for grandma and big mama and abuela, and so where are we with taking care of our women and helping our women take care of themselves as well? And so if we really believe in collective responsibility, if we really believe in being there for one another, if we believe in the aspect of community, being together as one, definitely take me up on this, hit me up, go to the Facebook group, right? Go to the Facebook group, find out some more about what I'm talking about as we launch this. We'll have stuff loaded up on the 9th, and we'll continue to promote and support, health and fitness. But that's part of where we need to wake up. We need to wake ourselves up in how we handle ourselves as stewards. We're stewards over our body as well as other aspects of what we've been given. And we only got one body, right? We only got one body, and how we handle it, that's going to come down to what we have to deal with later. Hey, I'm gonna say this on the real, when my mom was sick, dealing with cancer and all of that was going on, her other health issues impacted the type of treatment that she could get. Her other existing health issues impacted how far they would go with other, services and support and the extent of it. And I question this a lot of times, that when the doctor is eager to medicate you or cut on you, rather than to say, hey, what are you willing to change? Are you willing to change your diet? Are you willing to change your sleep habits? Are you willing to go into a less stressful situation and drop some relationships? Are you willing to back off of work or some other things? When the doctor says that, I can see where the doctor is giving a very, well-rounded, holistic approach. But when the doctor says, well, we're just going to give you some more chemo, and we'll probably hit you with some more radiation, and then, make sure you take those high blood pressure pills, and, we're going to keep that diabetes under control, and I'll see you again in 2 weeks. Come on, you got to give me more than that. You got to give me more than that if it's supposed to be healthcare. Listen, y'all, we can do this. Jump on the challenge. Like I said, get up in there. Hit me up in the Facebook group. The group is Life Path Multimedia. I'll let you in. I'm gonna start dropping some stuff in there on the 9th, but on the sneak tip, I'm really gonna be dropping some stuff in there today. And so let's get these 10 days under control. If you want to do more, but let's get it started, and let's start taking control over our own issues. Hey, you know what? This is Coffee and Chat, right? I'm Rev Bruce. I want y'all to know I appreciate y'all. Hey, this has been 6 months of doing this, and so next week I got a dynamic guest that is actually going to be talking about some changes that he wants to make in the San Diego community, and so definitely want to hear about him, but also hear his story, hear where he came from and what he's about. And so definitely tune in, check that out. We got some other guests, that are going to have some pretty good stuff that actually, the holidays, some tasty stuff coming up, hint, hint, right? And we got some other things going on that actually deal with, can we take control of our communities? Can we take control of ourselves? What's it going to look like in 2021? How are we finishing up 2020? Hey, it's all good. So God bless. Thank you for tuning in, and definitely hit me up to get more info about what we're trying to do with this 10-day detox challenge. Peace.